there's less patient interaction and there's more of paperwork and pre-authorization and fill this out, refill this, refill that.
Hi, everybody. Welcome to Be Empowered, the podcast. This is a podcast where we dive into the realities of healthcare and entrepreneurship. We offer our opinion, unfiltered, unapologetic, and always with a dose of empowerment. We're here to amplify voices, yours, ours, and challenge the status quo and explore what it really means to thrive. So let's get into it. I'm Dr. Santoshi Bilakota.
And I'm Dr. Shala Mokbel.
And today we have a very special guest. We have Mariam Ali. She is a board certified physician's assistant. She specializes in aesthetics, and she's the director of Zen Aesthetics Med Spa in Manassas, Virginia. And we're so excited to have Mariam on because we wanted to talk a little bit more about what business ownership looks like, not just for physicians, but also for APPs, just to explore what the possibilities are. When we get out of school, we don't really realize that we can have ownership of our own practices. And aesthetics especially is such a little niche that Mariam has been able to carve out for herself. So thank you so much for joining us, Mariam. Is there anything that I missed or anything you wanted to add to introduce yourself?
Hi, you guys. It was very nice meeting you. No, I think you did a great job covering it in a short amount of time.
So I'll ask the first question, Mariam. Do you want to start by telling us a little bit about what your background is and what led you to go into medicine to begin with? And then on top of that, what led you into aesthetics?
Sure, absolutely. So my background is ER. With some primary care and urgent care. I was actually pre-dental. So I went to George Mason pre-dental pretty much the entire 4 years. I actually got into dental school, went to dental school in Arizona for about a year and a half-ish. And it just I wasn't feeling it. Just wasn't right for me. I couldn't picture myself. So I kept pushing myself one semester after the next. So I was hoping that at some point I will fall in love with it and I will find my passion. And it just wasn't happening to me until my parents, they kind of pulled me aside. They said, "Hey, if you don't see yourself doing this, you're just racking up our money. So you gotta either stop or you better make it." And that was my kind of the point where I kind of stopped myself and thought it through. And it was a lot of money. It's about like $20,000 per semester. So I pulled back and I said, you know what? This is not something I want to do. But I also didn't know what I wanted to do. So left dental school, came back home, and being a Middle Eastern, that's a huge deal. They were like, okay, so if you don't want to do dental school, what do you want to do? I had no idea what I wanted to do. And that's when I explored my options, learned about physician assistant and compared the PA versus nurse practitioners and how they're both great fields, but for a physician assistant is a little bit valued differently, valued a little bit more to doctors and surgeons, a little bit more. So I took the PA route and went to PA school. And then now I have my aesthetics clinic after everything else that I went through, such as the primary care, urgent care, and ER.
What did you go into first? Like after PA school, did you start in the emergency room or did you start in urgent care? And how did that evolve into, hey, maybe I enjoy aesthetics?
Actually, my first job was in urgent care. And then a little bit of internal medicine, primary care, and then ER. It was really the burnout from all the other medical fields that led me to aesthetics. And it wasn't so. I was doing aesthetics while I was pursuing all these other medical fields, but I was doing it more as a hobby. So, and it was interesting the way I didn't really think it through. I was kind of sneaking out to go do my aesthetics job because I enjoyed it and it wasn't really, and there's a lot of med spas they don't have the volume like I do, which is, it's a blast. I'm blissful, but at the same time, it was easier for me that I'm glad they didn't have the volume or nobody would ever hire me. So they're only, usually most med spas are only open 2 to 3 days a week. very short window, so like few hours. Because I had another job, it worked out perfectly for me. So there was days that I would go do my aesthetics job and from like 9 a.m. to or like 10 o'clock until 2 o'clock, and then I would go to my regular job. So to me, it was kind of like a fun, kind of like a hobby until the burnout came about. And that's when my husband and I decided that he was like, hey, you actually like this. Why don't you just do what you like instead of using it as a hobby and try to sneak out? And kind of to him, it was more of like self-care. It was a place where I expressed myself, where like a lot of people, they go and paint, or people they go to a winery and have a glass of wine to wind down. For me, it was aesthetics. So I kind of shifted in an interesting way than others would.
Basically saying that it was kind of like a meditation area for you, from the
It
burnout.
was, yes, it was for me because the burnout was so high, and I'm sure you guys can agree.
Yeah.
Yes, the long hours, the charting, then just because your job is from 8 o'clock until 5, that translates to 7 a.m. to at least 6 p.m., and then you come home and you chart for another 2 hours. So there's no family time, there's no you time. You're just working, and it's not, and the patients are not happy, right? Because the charting takes so much time away from us, and there's less patient, I feel like less patient interaction, and there's more of paperwork and pre-authorization and fill this out, refill this, refill that. So and that was another thing, that if the patient was not happy, I wasn't happy, then why are we even doing this? So aesthetics was kind of like you said, meditation. I like how you put that way. But yes, it was like that. It was, I enjoyed it. I wind down and I got to be myself and I got to do what I wanted to do.
Do you feel that being a woman in medicine played a role in this? Did it add to the problems that you were facing, the burnout and the other problems that you were facing in the traditional role of medicine?
It can be a positive thing. It can also be a negative thing. So it's a huge role. The positive thing is that, no offense to men, but I feel like women, they have the eye for certain things. So they like faces, like aesthetics. We just have the eye for it, and I speak from experience. So I've worked with a primary care doctor. He was a PCP, and we were both doing aesthetics. Same off. It was actually his office that we were doing aesthetics. And when he had a new patient, and she would come in, for example, and she would say, "Okay, so I want to age gracefully. What do you recommend? What do you think? Where do I need improvement?" He would look at her and say, "Yeah, you don't need anything. You're good." So, and as a woman, I'm like, oh my gosh, that's not what we want to hear. We're all futuristic. We're all so hard on ourselves. And I feel like a woman to woman, I can, and he even said that. He's like, well, maybe you're doing well. You're doing better than me because you're a woman. So you already know what women want, and what how you guys perform and how you guys live your life. So how you see things. Where for him, it was and that was, I would say, like 80% of his patients. Like, oh yeah, because most patients, they want to see the doctor, right? They don't want to see the PA. They don't want to see the nurse practitioner. It's more of the preference is the doctor. And then when they got that kind of response, they were a little hesitant. Like, what do you mean? Like, at least discuss some kind of skincare, right? At least like prevention. But he wouldn't do that because to him it was fine. So as a woman, I feel like I had the eye for it. And most of the women that I'm meeting in this field, they have the eye for it too. The way the women work, it's so different than men. And then again, the downfall would be because we're not men, right? Because there's so most of patients, they're so men driven, especially the opposite attract. So they want to see it. I feel like they listen to men more than they would listen to women, regardless of our performance. So I guess it can be a negative and positive. Depends how you look at it, depends on the field.
Right. But what about when you were PA in the urgent care or, the hospital or the primary care? How about then? Did you feel that being a woman was harder? because you wanted to have a family, you wanted to have a, work-life balance, etc.?
Oh my goodness, of course, yes. And then same thing for the medicine as well. A lot of them, you would say the same thing, that okay, this is viral illness, then you don't need antibiotics, and they go back and forth with you. But for men, it was a little bit easier, and the men PAs, right, like the men nurse practitioners, and they were being called doctors just simply because they were men. They would automatically assume that they were doctors, like Smith, right? Like, and he was a PA just like me, but less experienced, less experienced than me. So as far as that, it was a little bit difficult, but I didn't mind. That was more of the patients. But as far as the work balance, yes, I feel like us women, we do have a lot more on our plates, where most men, it's just the job that they have to attend, and then they come back home, and that's it. That's their life. For us as a woman, even now, I feel like by the time I make it to work, and I have two kids, I have already lived my day. My day is done, and then I come to work. And it's like, no, there's a second day. So I feel like there's like 3 days in each day. One is when I actually drop off the kids and I get them ready and have them have breakfast with them, and then and we drop them off around like 10:30. So I open at 11, and then I come to work from 11 o'clock to 5 o'clock. That's my second day. And then when I go home from 6 o'clock until bedtime, that's a third day. So I feel like I live 3 days where, for example, my husband lives one day. So that's how I see it.
So, how did you get started in aesthetics? I know you were saying that you started as a hobby.
Uh-huh.
The reason I'm asking is because I think there are doctors I know, and there's other APPs I know who also have interest in learning how to do Botox and fillers, but it's not always so clear cut
Right.
how you get started. Because, I mean, there's courses you can take, I know that, but how did you start taking those courses? And then also, is there an internship that you did to get practice, or how did that journey go for you?
Yeah. All of it, everything you just mentioned. So lots of classes, lots of practice, lots of mentorship, lots of shadowing, and I think that's the hardest, one of the hard part of getting into aesthetics. And I feel like now that I am in aesthetics, I feel like I'm also a trainer. So when I train, for example, PAs or nurse practitioners or doctors, I can almost tell if they will make it or not, because aesthetic is not something you can learn. So the schooling that we go, like primary care or urgent care or internal medicine, we all go to school, we learn the same material, and then we prescribe essentially the same medications, the same first line, second line, and so on. Where aesthetics, I feel like it's medicine with art, but if you lack the art, then it's just not going to happen, because the art is 80% of it, or 70 or 80% of it. So even if you are top of your class, you were 100% well educated, and if you don't have the art, it's not going to happen. And it's really hard. It was first, I didn't realize these things when I was going through this, and I've done a lot of shadowing. So I've worked with a lot of providers, mid-level, well, I hate to say mid-levels, but like PAs, nurse practitioners, and doctors. And you could tell. So where there was this one office that I used to work at, it was a nurse practitioner and a surgeon, believe it or not. And half of their schedule was packed with procedures, and the other half was packed with follow-ups. So basically the things that go wrong, like complications, the returning patients, the bounce back. So it was those. And for me, I think it's more of like the person who I am. I will not be able to sleep if I had that many bounce backs, if I had that many follow-ups. That just means that you had a spot brow, or you did something wrong. So you're fixing your work basically. Where my schedule, it was mostly 99.9%. It was procedures, and we were required to follow up, to schedule our follow ups. I didn't do the follow ups because I didn't want to waste their time. So usually it was me and the management, we would go back and forth with that. And it's like, well, you need to do a follow-up. Like, well, I let them know that if in 2 weeks, if you need anything, or like even after 2 weeks, but 2 weeks was our pretty much our follow-up timeline. If you need anything goes wrong, you just let us know. But everything went well. So seeing those kind of, I wouldn't say compare myself, but I was comparing myself to other people, just to see, kind of like testing myself to see. And they all were in aesthetics for many many years. Then and I felt good about myself. I felt good about my work. So, and that's how I started my own business. I started my own clinic. Um, that I was confident that I was able to make it.
So I'm sure there were some fears and challenges that you faced. Can you name a few? What was your biggest fear, and what were the challenges that you faced transitioning?
Number one fear for all of us, failure, right? Because failing is a huge part of this business. It's the rate is huge. So when I was, even before, when I had the business, when I was doing the other jobs, when I was in medicine, I followed a lot of social media pages like Facebook groups or Instagram, and I was just following everything aesthetics. So even now, when I get on Facebook, there's a there's like one personal friend for every like five aesthetic groups, and I was interested in those. I always followed them, and when I was getting into it, there was at least like one or two med spa closing a day that I was seeing. That, okay, I'm located like, let's say, Texas or Florida. I'm closing my med spa, and I have these items for sales, and I have like Botox or fillers or whatever they had for sale. So that was the biggest fear. That and then we still face that. That's still there. But and I still see that, believe it or not. I've been in it for about 4 years now, and I actually just came across one and on Facebook today that med spa in Florida is closing, and she had some lasers that she was trying to sell. So failure would be a huge part of it, and it exists. It's there every day, and that was a challenge for me to start. Just the fear of it, just the feeling, just the knot in your stomach every day, whether you're gonna make it or not. Because I'm not any extraordinary than anybody else. I'm the same person as you. I'm the same person as another person who owns aesthetics. So it was scary to, like, what sets me apart from everybody else? Not, to me, not much, right? Because I'm still, at the end of the day, I'm still a PA. I'm still a human. Don't have anything extra. So that was the fear throughout my journey.
What prompted you to start your own practice instead of maybe working with one of your mentors or joining another med spa?
I did do that, actually. I've done mentorship. Mentorship is very, very difficult in this field, and I feel like that's the main reason that a lot of people, they don't want to do it. Because and now I get it. So I used to get upset because I had friends, and not, I wouldn't say friends, but the acquaintances, or like people that I knew through some people. So I would message them to see if I could, or even I actually had, there was one girl, she was a nurse practitioner that I worked with at my very first job in my urgent care. She went into aesthetics for a few years, and I reached out to her and a few other, asking them question, or like, because when you're new, oh my goodness, like it's like, it's a huge world. There's a lot that can go wrong. So the saying is that, we're not saying that you cannot do it. The saying is that when something goes wrong, you should be able to fix it, right? So the rate of complication is huge and it's very high. So I kept reaching out to all these people, all the PAs and nurse practitioners and the doctors, and I was on red all the time, and they would just leave me hanging there for forever, or like they would respond to me maybe like every few weeks with like a short answer, or most of the time yes, no, kind of thing. So that's discouraging for anybody. So basically I did it on my own, and it was clear that they either didn't have time, or they don't want to do it, or competition, or whatever the reasoning may be. So I started looking into courses and training, the paid training, on my own. So I've done a lot of training, and we still learn. So the more you learn, the better your craft, right? So I actually have another class training in July next month. So I'm always on top of education, on top of learning. In my early stages, yes. So I had to look into courses. There was a lot of, so there was like an AAFE. There's so many courses out there. They are very, very expensive, and there are, I guess, providers or trainers or injectors, whatever you want to call them. They're actually offering half a day of mentorship or shadowing for like anywhere between from $3,000 to like $10,000 for just to be there. I thought that was crazy. And me being a new mom, and we were in the middle of building our house, and starting my own business, I didn't have that kind of money to throw at every injector. So I did do some, but I would say my education, my training cost me around like 24K to get started, to feel comfortable. And it was the best investment. I don't regret it a bit.
How did you manage the fears that you have along the way, the doubts?
That's a good question. It was really the results. So, and we all have doubts when it comes to any kind of work, but it was more of when you do something the right way, when you especially when it comes to aesthetics, like you put your heart and soul into it, and the patient is happy, you're happy. And when you treat a face, now I'm learning this, I didn't know this before. So when you treat a patient, you're not only treating that patient, you're treating that patient's family and friends. So when you see their family and friends coming to you and saying that so and so sent me here because so and so looks so good and she feels so good about herself, that's how you eliminate the doubt a little bit. And it's really word of mouth, and it's the reviews too. Actually, the reviews give me a big head. I have over close to 250 reviews, and um, 5-star. So I'm very happy with all the patients, all the results, and that's really what keeps me going. That keeps me motivated. And as a mom, you know how it is. We always prioritize our family and our kids, but those are patients are the satisfaction, the results are the only things that bring me back to work that doesn't feel like work.
I was on your Instagram, and we'll put a link to your Instagram as well. And you offer a variety of services, like lasers and Morpheus and all of those things. How do you go to training to learn those, or how do you become comfortable doing all of the new cutting edge stuff like the exomes and the PRP and all of
Yes.
those things?
Oh yeah, absolutely. So lots of training, lots of learning on your own. And the companies actually require a lot of training, and you have to go through the training with the company and then outside of the company until you're comfortable. So as far as the training, yes, there's lots of them. So I'm a trainer for the PDO threads, which is the facelift. So and I was the trainee at one point. So, and then they see your work. When they choose the trainer, they see your work, they see your results, they see your complication rate, which mine is zero complication and 100% patient satisfaction. And then they invite you to become a trainer. But yes, there's lots of training, and it's not a couple of days, a couple of weeks, and it's years of training. So we've had the Morpheus, for example, the Morpheus device for about 2 years now. And I started the training when I was very early in my aesthetic journey. So it took me about 2 years to bring it on. And then I didn't start right away, obviously. And then there was more training on site. There was more models, obviously family, friends. Um, but yeah, and that goes with every single treatment, whether it's Morpheus or the threads or the Botox or the fillers. And there are different types and kinds of fillers in different companies. So like Allergan is for Botox, and Galderma is for Restylane, and they have their own training. So they train you on their own products, even though they're essentially let's say like fillers. They're all fillers, but each company, they expect you to go through their training. So you're very familiarized with their product.
What's the best way to find these courses and the education?
Well, I go through my husband because he he's really good with computer and finding things. So I usually just ask him, and he finds me the courses. And then another source would be the companies themselves. So depending on what you're looking for. So if you're interested in again, like the PDO threads, you reach out to the company, and that's the best way to do it. They train you. They provide all this the supplement and the courses, and then you can take more, and then they can refer you as well, that okay, this company is really good if you want more hands-on training, and so on. So usually, it's between my husband and the companies themselves.
We're going to pause here for this week, but don't go too far. We'll be back for part 2 next week, and we'll tune into the rest of the conversation. Thank you.